Within this presentation, I'm going to talk about a call I attended back in November while out on a solo responding vehicle. I will consider the legal ethical issues around this case involved. As well as this, I will also explore the boundaries of practice and the model of legalisation governing the use of prescription-only medication by paramedics. Myself and my crewmate were called to a 24-year-old male experiencing a seizure in a mattress store. When we arrived, the young man was laying in a prone position between two workshop tables. The patient had a small superficial wound to the back of his head which he caught on the table whilst convulsing. By the time we had arrived to the patient, he had been convulsing for around 4 minutes, according to his colleagues. A pillow had been placed to the side of his head to prevent any more trauma. The patient had a GCS of around 3, and according to his colleague, it was his first day at work, and if they were unsure if he was a known epileptic, we called for grade 1 backup, which arrived shortly. The UK Equality Act of 2010 states that people with a protected characteristic do not have to automatically tell their employer about their disability, in this case epilepsy. As long as they are confident they can undertake the task involved, the Act states that the employer must make reasonable adjustments within the workplace for the employee with the protected characteristics if they are made aware. The employee may not be fully covered under the employer's liability insurance if this information is not disclosed. I was able to conduct a set of general observations to rule out any potential reasons for the convulsions. His temperature was 36.7, his blood glucose was 6.2, his SpO2 was 91%, his heart rate was 101, and I was unable to get the blood pressure and arrest rate. We also administered high-flow oxygen. From my observations, we was able to rule out febrile and hypoglycemia for the reasons behind the convulsions, and due to the patient not being pregnant, I was also able to rule out eclamptic convulsions. One of the most common reasons for adults experiencing seizures is epilepsy. The condition affects about 1 in 100 people in the UK, and understanding the origin of the seizures will assist in determining the appropriate treatment. It is also prudent to look for the patient's wrist or neck for a talisman. This is a good identification if the patient has epilepsy. According to the JLCAL, patients who have prolonged seizures lasting 5 minutes or more, diazepam should be administered. During these long convulsive seizures, oxygen is not circulated around the body properly, and the brain does not get enough oxygen. This can lead to brain damage. Diazepam is a central nervous system depressant, acts as an anticonvulsive and a sedative. Due to the environment and the position of the patient, myself and my crewmates on scene concluded that IV diazepam would not be the most suited way for administering the medication. The team leader on scene decided to give 2 rectal tubes containing 10 milligrams of diazepam. A short while after, the patient's convulsions stopped, and the patient was in a semi-conscious state with a GCS around 11. As a paramedic, we have the responsibility to offer the best possible care at the given time. According to the Healthcare Professional Council, we must act in the best interest of the service user at all times. My mentor and the team leader both had made the clinical decision that rectal diazepam should be administered. We worked based on implied consent, as the patient was in a critical way and was in need of medical treatment. In an emergency situation when it is not possible to find out a patient's wishes, treatment can be given without the patient's consent, provided that the treatment is necessary to save their life or prevent any serious deterioration in their condition and in their best interest. Once we were able to, the paramedic explained to the patient that we had administered rectal diazepam, as he had been seizuring for around 7 minutes. The patient became quite distressed and explained that he was a known epileptic and he has been known for having prolonged seizures. He then said he felt dehumanized that we had administered the medication in this way without his consent. At this point, he became quite hostile and began to make his way outside the store. Deontology derives from the Greek word duty. A deontologist approach would look at the action itself and whether the action is right or wrong, opposed to looking at the rightness and wrongness of the consequences of those actions. It focuses morally on the right thing to do, even if the outcome doesn't benefit the larger majority. I believe we worked in a deontology manner while attending the young male. We believe that giving rectal diazepam with only implied consent would be going against the service user's personal boundaries, but at the time we believed he was acting in his best interests. Back to the case study. As a paramedic, the paramedic on scene kindly asked the patient if he would step onto the ambulance for some further checkups. The patient refused and became quite verbally aggressive towards us, saying how he dealt with epilepsy his whole life and there was no need for him to go to hospital. An individual has the right to make what others might regard as an unwise decision. This means the individual has their own values, beliefs and preferences that may differ from other people. This does not mean that they are lacking capacity because of this. Despite our encouragement for the patient to come to hospital, he was persistent he did not want to, although we stressed the importance of him coming and how we felt that it was unwise and potentially dangerous decision, but we must respect his autonomy. As we deemed the patient had capacity to make his own decisions, the patient's autonomy was respected, even if the clinician disagrees with the service user's decision. In this situation, the patient was determined to look after himself and insisted he did not need to go to hospital. As we had a duty of care to our patient and to act in the best interest, it is important that we try and help him to understand the implications of not attending hospital. The virtue theory takes a different approach to deontology. Instead of following a set of rules, this type of moral theory is about becoming a certain type of person. The virtue ethics aspires to develop good people. By being a good person, good things will follow. Virtue ethics teaches not what should I do, but rather what person should I ought to be. By taking a virtuous approach, we were able to calmly explain to the patient our reasons behind why we administered the medication in this way, and how we felt it was in his best interest as he was in a critical way and we believed his health was at a potential risk. The patient continued to refuse to come to hospital, but we was able to gain his consent to treat him on scene. Once we were satisfied with the amount of information we had gathered and we was happy with the patient's health, we told him that he should go home and rest, and if he at any point did not feel himself, he should call 999. Informed consent means a voluntary decision made by an autonomous person with full knowledge of the possible consequences. The decision must be made based on inadequate information has been given. I felt this experience was invaluable to my future as a paramedic, as it was the first time I had encountered a patient not appreciating the services. The input was good, and it was good to see the more experienced team member handle the situation. Thank you.